Alright, I'm going to explain something. So you have a baby and you have a uterus, okay? Let me get another baby. Hang on 1 second. Alright, so another baby and again, a baby and a uterus, okay? So the baby is inside the uterus. Let me get another one now. Okay, another baby.
GBS or Group B strep is a simple yet an important subject to understand in obstetrics. So what is GBS? GBS is a gram-positive bacteria that colonizes the perineum in about 10 to 30% of the women. It doesn't usually cause symptoms, however, it can lead to urinary tract infection or can cause intrauterine infection during pregnancy, also known as chorioamnionitis. The reason why we care about it is because it can cause early onset neonatal disease characterized by septicemia, pneumonia, and to a lesser extent meningitis. That usually manifests in the first 12 to 48 hours after delivery. Risk factors for early onset disease are preterm delivery, prolonged rupture of membranes, intraamniotic infection, and young maternal age. The drug of choice for treating GBS is penicillin during labor. If the patient is allergic to penicillin, we have to assess the type of allergy. If it's not a severe type of allergy like anaphylaxis or hives, then the patient can have cefazolin, which is a first-generation cephalosporin. Otherwise, we have to perform clindamycin sensitivity testing. If the bacteria is sensitive, then we can give clindamycin, otherwise vancomycin is recommended. Intrapartum antibiotic administration is recommended if the routine vaginal rectal swab after 36 weeks is positive, if the patient had a previous baby with early onset disease, or if the urine culture grew GBS at any point during pregnancy. Testing should be done routinely by culturing a vaginal rectal swab that's obtained after 36 weeks. On some occasions, however, the patient may go into labor and the GBS status is unknown. Antibiotics are indicated if the patient develops fever, if there is prolonged rupture of membranes for more than 18 hours, if the patient is in preterm labor, or if there is a history of positive GBS testing in a previous pregnancy. Some hospitals have the rapid nucleic acid amplification testing, which is a reliable test. If the test result is positive, then intrapartum antibiotics is recommended.
If you want to support this channel, please like and subscribe. Thank you, and see you next time.